And I do that because I like this feeling of being connected, being available, being able to respond to my patients when they need me. Um, and it enables me to get to know you on a personal level.
Welcome to Wisdom Beyond the Womb. I'm Trisha Harris with Trisha Harris Photography, and today we're sitting down with Ashley, and she's going to share with us about her concierge healthcare service. How are you today, Ashley?
I'm great. How are you, Trisha?
I'm doing well, thank you. So tell me about your concierge service that you provide for Brevard County.
So I am the only dual certified provider in the county for family health, family practice, and psychiatric mental health that will go to someone's home and do a visit. I do offer in-clinic services as well and telehealth. I have a small office across from Wickham Park, right at Parkway and Wickham. And so far, so good. So my patients, my clients really love me. They like the feeling of having their provider accessible, I'm only a phone call away, instead of calling an office and having to speak to 2 or 3 people and leaving a message, and maybe someone will get back to you in a week. My clients, have my number and they call me or text me and receive a response within that day.
So you said dual certified. Tell me more about that.
So I am certified in family medicine. So I can take care of people across the lifespan, so newborn babies all the way up to 100 years old, dealing with chronic illness, so things like diabetes, high blood pressure, high cholesterol, things of that nature. Basically, your primary care doctor. And then I'm also certified in psychiatric mental health. So I am able to prescribe medications for mental health and help people in that way, very similar to what a psychiatrist would do.
That's huge.
Mm-hmm.
So that's awesome that you offer both of those.
Yes, I'm like a one-stop shop.
You are a one-stop shop.
Yes.
That comes to me, though, right?
Yes.
Even better. So you mentioned you were dual certified and you have psychiatric as one of those certifications. We had 2 others in here kind of talking about mental health earlier.
Mm-hmm.
So tell me how that relates to your practice around moms, postpartum, and just helping them in that area.
So I am certified in psychiatric mental health care, meaning I can prescribe, treat, and diagnose people that have mental health problems. And it's important when it comes to new moms because postpartum depression is so common and it's something that's not really talked about, it's not addressed. I know with my own 2 children, during the entire both pregnancies and aftercare, I was asked once by my pediatrician at my daughter's or my first child's 6-month appointment. So it was never really addressed. It was never brought up. And I personally had gone through a very bad bout of postpartum depression. It's just something that I feel new moms aren't really supported on. They're not really heard. They're not asked. And so my message is to, speak up, and there are resources and there are people out here able to help, and to also build a village, instead of waiting for the village to come to you, like in Shrek, how they come with like the pickaxes and stuff. Build the village. So kind of have plans in place and backup plans. And mental health is so important. It's important to take care of yourself and take care of not only you physically, but mentally as well.
Yes, that's so huge. Build a village and to not be afraid to speak up about it. And so are they able to do that virtually and in person?
Absolutely. Yeah. So they can come to the office, they can do it virtually, or I am happy to make a home visit, which is great for new moms that maybe don't want to leave, don't have time. I know with both of my babies, when they were really tiny, the last thing I wanted to do was pack them up and wait in an office. Yeah, Yes.
Just driving anywhere with them is so difficult.
Yes.
Even better. Do you take insurance or you just self-pay?
So for the psychiatric portion, I do take insurance, and I take all major insurances, including Medicare and Medicaid, which is huge.
Mm-hmm.
But for the concierge home visits, that is self-pay.
That is self-pay. Do you present the super bills and stuff for them to be reimbursed through insurance? Should they try?
I do not.
Okay, good to know.
No, I don't. Not for my self-pay clients. I don't. My rates are really reasonable, considering what it is. So I haven't been asked yet to do that. That could be something that I look into doing in the future. But I can see the hesitation where insurance companies would not want to pay for someone to come into the home for liability reasons.
Understandable.
Yeah. So that's why I haven't really pursued that avenue of things.
Well, if I have a primary care doctor whom I love and see regularly once a year for
Mhm.
checkups and stuff, can I still use your services as like to fill in the gaps?
Absolutely. Yeah. A lot of my clients do that. They have someone that they love, that they see, that they've been with for years, and they're just not available when they need them, or they're on vacation, or they're out of the office, or their next availability is 2 weeks away. And if you have a cold or a flu, you can't really wait 2 weeks. And so I will absolutely help and assist and coordinate care with your primary care physician if that's what you want.
Perfect. And is there usually like a new patient setup that needs to take place first before we can get down to the nuts and bolts of why I need your services? Like I'm sick or something? Or can it be all done together?
It can all be done together. Yeah, it's pretty straightforward. So you just contact me, and step one is, I kind of screen what's going on and make sure I can help you and send you some electronic paperwork, consents. Make sure you're aware of what the services are and the cost and what all it entails. And then you would complete the consents, and then we would proceed with your visit. However, that may be either virtually, in the home, or in the office.
I love that.
Mm-hmm.
Makes it so convenient.
Yes, and it's often same day or within a couple of days, which is nice.
And then a lot of times moms are needing like a school note and all of that when their children are sick.
Mm-hmm.
And it's just required now. Is that something you provide?
Oh, yes. Yes. Mm-hmm.
Perfect. So how do we get in touch with you?
So the best way to reach me is by phone. You can also send me an email that comes directly to me. So I am what's considered a micro practice, meaning it is me and one other assistant support staff. I keep it that way because I like things to be simple, and my caseload is much smaller than a normal doctor's or normal provider's. A local primary care physician can see anywhere from 400 to 600 patients.
Wow.
Yes, and some even see more than that. I cap out at 200.
Okay.
Yeah, and I do that because I like this feeling of being connected, being available, being able to respond to my patients when they need me, and it enables me to get to know you on a personal level.
Definitely has that old school vibe.
It does, and I kind of love it.
Yeah.
That's what I wanted for myself, and there really wasn't that service available, or it didn't exist, and so I created it.
Well, you're definitely putting care back in healthcare, so I love that.
Yes.
Do you have a website?
I do have a website. And there are links on the website to contact me via email. I also have a Facebook that people can follow if you're interested. And all of my services and pricing are posted on my website.
Awesome. Ashley, thank you so much for coming in today and sharing all this awesomeness about your concierge healthcare service for our community.
Yes, thank you for having me.